Good morning, everyone. My name is Anita Osuri, and I'll be presenting on Hope for Huntington's Disease. I'm a rising 12th grader at Biotechnology High School in New Jersey, and I'm looking to go into global health in the future. I have founded numerous high school volunteer groups and STEM education events to foster a love of learning in middle school and elementary school children. I'm also the co-founder of New Jersey Youth for Huntington's Disease. And outside of that, I love drawing, realistic portraits, fashion design, hiking, and kickboxing. So let's get right into Huntington's. It's a neurological disease caused by a rare autosomal dominant gene mutation, which means that if one parent has it, then there's a 50-50 chance that their child will also have the disease. This mutation causes a protein, Huntington, to form in brain cells, which leads these cells to being damaged and eventually they will die. Symptoms include mood swings, impaired judgment, involuntary movements, slurred speech, or difficulty swallowing. And the symptoms are often described as a cross between Parkinson's and Alzheimer's. Unfortunately, as of now, there is no official treatment that can reverse the progression of the disease, although there are options such as physical therapy and social support that can help patients. It's also important to note that there are two forms of the disease, juvenile and adult onset. Adult onset is the most common, and it usually emerges when the person is around 30 to 50 years old, so in the prime time of their lives. The blue area in the picture to the right is the area of the brain that Huntington's mainly affects. How common is Huntington's? Overall, it is rare, but it's the most uncommon in South African populations, and it is most common in European and United States populations, as it's thought to have emerged from Europe. However, there are areas in Latin America where it can be more prevalent than in the previously mentioned countries. For instance, in Maracaibo, Venezuela, there's the largest genetically related HD community. Over 23 years, researchers have identified 18,000 individuals living with Huntington's, and they are all from 83 groups of related families stemming from a common ancestor. Dr. Nancy Wexler and her team discovered the gene involved with Huntington's through researching this group of people. However, the people of Maracaibo are still living in poverty. Many have inadequate healthcare, nutrition, and living conditions. People with the disease are also unable to work and must have family care for them. This is a crucial point, feelings of familial burden and paranoia. For children of HD patients, it's a constant fear that they will inherit the disease, and they must also take care of their parents that may have it. During my journey through learning about Huntington's, one of the organizations that I'll mention later, Factor H, sent a video about a child, Johandri, living in Colombia. She stated that, "When I grow up, I want to be a great scientist, to take care of my family with Huntington's disease, to find a cure, to help other people with other diseases." And this is a common theme that people in these communities have. They constantly hold hope. Similarly, from South America to the Asian continent, there is a huge issue with acceptance of patients. There are many taboos in China when it comes to HD, and people affected will often not even tell their family out of fear. A broadcast in Chinese news about 4 years ago showed the grave situation of people living in HD in Asia. Patients must be bound to physical surfaces to prevent harm from involuntary movements. And the families are left heartbroken because they feel that someone who was once so lively could become a completely different person after a few years. In fact, one of the patient's husbands said that the medicine gives no results now. So many medicines, there just isn't any to cure it. Cancer can be cured now, but Huntington's can't. So what are organizations doing to combat this crisis? The organization Factor H, which is where I actually first started to develop an interest in Huntington's, provides supplies and aid to communities in Venezuela and Colombia with a high prevalence of the disease. In China, Ms. Shi Cao created Hyacinth Care, an organization dedicated to providing support to patients with rare diseases. She comes from a family of Huntington's herself, and she helps other families get rehabilitation support and medical insurance. CHDI, a nonprofit, helps develop drugs that delay the progression of the disease. And the next organization, perhaps most well-known, Huntington's Disease Society of America, was founded by famous singer Woody Guthrie, wife Marjorie Guthrie, and their goal is to improve the lives of those affected by Huntington's through education, advocacy, community services, and research. HDYO, or the youth organization, also provides education as well as support for youth affected by it. Many of these organizations have annual conferences that I strongly encourage you to attend if you're interested. Inspired by the efforts of these organizations and the hope of Huntington's patients, I, along with a group of my peers, co-founded an organization called New Jersey Youth for Huntington's Disease, a group dedicated to awareness, fundraising, education, and hope within our local community and beyond. Awareness, one of our most important pillars, is accomplished through educational videos that we display at local community events. We fundraise through our GoFundMe for Factor H, where we raise money for educational supplies for HD-affected communities in Latin America. Education has also been involved through interviews with numerous well-known HD research scientists to understand their perspective on research and humanitarian efforts in highly affected countries. We're currently in the process of making these available to the public so that everyone can learn more about this disease and how to be involved. We're also utilizing social media platforms to reach more youth. And lastly, we retain hope, just as the patients have, that one day we'll be able to provide an official treatment for Huntington's disease. We envision that more youth will also be interested in HD research and humanitarian efforts. Throughout this journey of learning about this disorder, I encourage you to take away the importance of including lesser-known diseases in the global health realm. It's crucial to provide these patients a platform to advocate and raise awareness. In addition, as seen by the 2 case studies in Latin America and China, the disease exhibits itself in similar ways in different patients, but the affected person's situation may be different based on cultural customs, location, or taboos. Hope is crucial, and throughout all scientific advancements, that's what keeps us going to satisfy our innate curiosity about the world. Most importantly, teenagers can make a difference. Organizations such as HDYO and our organization inspired by these patients have been trying to make strides toward increased awareness and education. Remember, hope is in our hands. I want to thank the Johns Hopkins Global Health Leaders Conference organizers for providing us this platform to share our ideas and experiences with our peers. Thank you as well to my parents and mentors for supporting me through this journey of exploring global health. Here are my references, and if you have any questions, please feel free to reach out through my email or my Instagram. I also put the Instagram of our organization there as well. Thank you so much for listening.